Today's television pro examines why married couples have difficulty getting pregnant and what they can do about it. For instance, are they just too old to conceive a child? Is it just a non-curable medical problem with one or both of the partners? Is in vitro fertilization the only possible answer, although the cost, success rate, and tangential problems of this method are still rather discouraging? And what about the moral and ethical issues of the couple? Are the values being compromised by in vitro fertilization? Today's guest will address these questions. I think you'll find today's show to be unique, informative, content-rich, truthful, and thought-provoking. Today's guest is a magna cum laude graduate of Assumption College, I believe 1982, and a 1986 graduate of St. Louis University School of Medicine with honors in both ethics and high-risk obstetrics. Our guest is a board-certified in family practice medicine and recently chaired the family practice department at Haywood Hospital in Gardner, Massachusetts. His medical practice goes by the name In His Image Family Medicine, PC, which features obstetrics and something called NaPro Technology. Among his many accomplishments and affiliations, he's a graduate and now part-time faculty member of the Natural Family Planning Medical Consultant Program of the Pope Paul VI Institute for the Study of Human Reproduction in Omaha, Nebraska. He is also certified by the American Academy of Fertility Care Professionals and is a member of their ethics committee. He and his wife, Suzanne, are the proud parents of 4 boys. Welcome to our guest, Dr. Paul Carpentier.
Great to be here, Brent. Thanks for having me.
Nice to have you, Dr. Carpentier. Before we get started, I would just like to mention the call-in phone number should you, our viewing audience, have any questions for our guest regarding conceiving a child. The number is 617-973-4848. Well, one of the themes of this show, Dr. Carpentier, is to highlight the broad mosaic of the Right to Life movement. How did your journey evolve in this regard?
Well, as I was in training at St. Louis University School of Medicine, I really wanted to put all of the things that I was learning in medical fields to apply it to women who are struggling with their problems with their fertility, such as infertility, yes, but also PMS and ovarian cysts, abnormal bleeding. We just see so much of this, and the natural response is, here's the birth control pill. It takes the doctor 15 seconds to write the prescription. Everybody knows how to take it once a day. Off you go. But that's treating maybe some of the symptoms, but not treating the underlying disorder. And this specialty comes about called NaPro Technology, which stands for Natural Procreative Technologies, using all of our medical skills that we have in family practice and obstetrics and gynecology, and applying it to these medical conditions that these women are beset with. We're trying to get to the bottom of why they're having trouble and fix that so that their body works naturally, so they can conceive naturally, one embryo at a time.
I see. Now, after your name, I noticed, of course, the acronym MD for medical doctor, but what is the acronym CFCMC? What is that all about?
That's Certified Fertility Care Medical Consultant. That means I'm a medical consultant, a physician trained in the United States, and certified by the American Academy of Fertility Care Professionals. And this is an academy that's started here in the United States but now has international renown. And in fact, I've received one of their prestigious awards. I'm one of 6 people in the world certified as an outstanding medical consultant in fertility care services. So the foundation of what we do is that the woman is observing her ovarian function using the Creighton model of natural family planning. She's observing the ins and outs of her cycle, and she can tell exactly when she ovulates, but more than that, she can tell how well she's ovulating. Wow. And how well the ovary is working. With that experience, we can now direct our testing, whether it's ultrasounds or blood work, to hone in on the exact causes of her problem.
I see. How well it's working? How do you mean? I mean, if it's working, how well it's working?
Well, when people think about natural family planning, they're thinking, okay, well, let me identify the time that I'm fertile, and I'll try to avoid intercourse on those days and therefore space my children. But to do that, you have to know how well your ovary is working, or when it's working, when it's fertile and when it's not fertile. And you can tell by simple observations the patient can make at home. She's trained by a certified teacher. And then if, with the teacher's help, they're recognizing that, yes, things aren't going well with my cycle, the teacher can refer her to a doctor like myself anywhere in our country or Europe or Canada.
Now, what are some of the more common problems of married couples being unable to conceive? Is it old age, or what are some of the problems typically?
Well, old age is...
Old age, middle age.
Yeah, it's with our delayed childbearing, with our fast-paced culture, people are delaying childbearing into their 30s, and unfortunately it's only at that time that they're recognizing that all through their life they've had various problems such as polycystic ovarian disease or endometriosis. These are things that can interfere with their fertility, and these issues are only coming to light in their 30s. After age 35, it's more difficult to help somebody to achieve a pregnancy. So, be it as it may, oftentimes we're seeing people in their 30s with these problems, and we need to work very quickly to help them to improve their fertility.
I see. And yet women have had children into their early 40s or mid-40s oftentimes.
Certainly. Especially women of normal fertility, certainly you can be achieving pregnancies up until age 45, sometimes a little bit later. But if there are some conditions that are making your fertility less promising, then we really need to be on top of that as soon as possible.
And what about the man in this situation? What issues come up with him?
Well, obviously, impaired sperm counts and impaired sperm motility as well are issues. And I think there needs to be more work on what leads to those low sperm counts and low motility. We don't really have any good factors. We talked about varicoceles in the past, and men would go through varicocele surgery, but now the doctors that are specialized in varicocele surgery are sort of wondering if they're really making much of a dent. And I've spoken to one of these doctors from Boston, and he said that the most important thing that we can do is help the woman's ovary and cervical mucus to be at its top condition, and the sperm will get where they need to go, even if they're low in number and low in motility.
I see. Very interesting. You had mentioned something about I didn't hear the word before you just mentioned it regarding the men's sperm.
Motility?
No, not motility, but not sperm count, but there was something else you had mentioned there. A word.
Oh, varicocele.
Varicocele. Yeah. What is that?
It's just like some people have varicose veins in their leg. There can be varicose veins around the testicle, which can raise the temperature around the testicle and potentially decrease sperm production.
I see. Okay. Very interesting. Now, your success rate, or your group's success rate in achieving pregnancy for couples is much greater than, say, I'll call it traditional in vitro fertilization methods. Why is this the case?
Well, our studies over the past 20 years have shown that we have a success rate of about 60 to 80% in researching delving into why the couple can't achieve a pregnancy and trying to fix that problem. We're able to help 60 to 80% of the couples depending on what the cause of their infertility is. And with IVF, there's some research that goes on into the couple before they head into the IVF procedures. IVF, of course, stands for in vitro fertilization, which basically shorthand would be that we're sort of bypassing their fertility. We're harvesting the sperm, harvesting an egg, putting it in the petri dish, achieving so many embryos, working on techniques to try to decide which embryos might look the most healthy and reimplant those embryos. How many embryos, up to the couple and the doctor to work that out. What they do with the extra embryos is matters for debate. And so then we're putting those embryos back into the womb and hoping that they take. Our system is more delving into why can't the couple get pregnant? What are the underlying problems, such as endometriosis,